This is section 10. This is one of the Bufo marinus frogs that were used for experimentation. And as you can see, he had these white spots underneath when viewed under the infrared camera. And I thought, what are those? And I looked, and there seemed to be smallish lumps there. We left it for 8 days because we were looking to see how long the sensitizer lasted in the body. And 8 days later, it's still heavily into these spots. This animal was euthanized humanely. I hate doing animal research, but these animals were scheduled to be destroyed. So I used them for research and then gave them a little ether party and put them to sleep humanely. The autopsy on this frog showed that these areas, these white areas here, here, contained pus. So they were bacterial infections. We know that PDT can kill bacteria. Golden Staph tested to 20 generations of LD50 kills. That's how you determine whether an antibiotic is going to be effective long term. You kill half of a particular bacteria with the theory that the half that survive are going to be the strongest and most resistant. And then you breed them again, and you keep doing that generation after generation after generation. Most antibiotics, they'll become resistant in 4 or 5 generations. This has never shown any indication of ever developing a resistance to PDT. If you go by hospitals, you'll see people sitting out in a wheelchair with a missing leg, a fresh amputation of an arm, and they don't show any signs of having been in an accident. They aren't scarred up, cut, and everything. You'll find that most of the time what's happened is they got a staph infection. They probably got it in the hospital. And after they try them on some antibiotics, if they don't work, they bring them back in and they try to cut it out by cutting out an area around the infection, which means you lose muscle, you lose skin, you lose blood vessels, you lose part of your body. If that doesn't stop it, then they bring them in and they get out their marking pin. They draw a dashed line around the arm of the leg and they say, we're going to have to amputate it here to save your life. And they cut it off. When I see that, it makes me so angry. I'm absolutely furious because, quite simply, I can stop this in 15 minutes. We know we can. We can do it even when it's inside the body. We've done it from the outside. And we've also done it in the bladder. This is a patient who came to us. He had methicillin-resistant Staphylococcus aureus and Pseudomonas, both extremely lethal bacteria in his bladder due to a catheter that he had in that had been contaminated in the hospital. They'd had him on antibiotics for months, and they couldn't stop it. Eventually, they told him the antibiotics were destroying his liver and his kidneys, and they were going to stop dispensing the antibiotics, and that he probably only had a couple of days to live. He came to me and said, I'm in a spot of bother. It was an Australian shearer. And I said, what's the problem? And he said, well, I've got this infection and they told me it's going to kill me. And I said, I've got a terrible fever. So I use a special digital non-contact thermometer. So I said, okay, let's see. I checked him. Sure enough, his temperature was 0.2 of a degree below the point where brain death sets in. And I said, so what are they going to do about it? And he said, well, they told me they can't do anything, that I'm going to die. And I said, well, look, you've already got this catheter in. If the hospital's not going to do anything, we can try putting some sensitizer in and using the laser from the outside. I don't know if it'll work, but it's worth a try. So we got a urine sample, spun it down, put it under the microscope, and that's what you're looking at on the left side here. These large things are white blood cells that have been trying to fight bacteria and losing. The small white dots are Pseudomonas. That's like here, here, here. The rods, like there, are methicillin-resistant Staphylococcus aureus. We treated him with the laser for 15 minutes, and he said, oh, I think I've come good. So I said, all right, I don't believe it. I don't believe your temperature could go down that fast. But I measured it and it had. And we withdrew a urine sample, spun it down, and this is what it looked like 15 minutes later. There are no bacteria there. Everything's been basically exploded. It's nothing but juice. There's one dead red cell on the left. Everything else is gone. That's how fast you can control this. They were going to let him die because their antibiotics didn't work. Again, this is nothing short of a miracle, and it cannot be done with most forms of photodynamic therapy, but it does work with ours. In the next section, section 11, we'll discuss some diseases.